Hi, I'm Jill. I'm a manager of outpatient services for the Dual Diagnosis Program at the Center for Addiction and Mental Health. Today, I'm going to be speaking with you about how to use community resources, such as emergency services, when working with your individual with an intellectual disability. One of the first things you might ask is, how can emergency services help? One thing that you can always do, whether you're a parent, a sibling, or a paid caregiver of someone with an intellectual disability, is contact the police station in advance. This means that on a day where your son, daughter, or the client you're working with is doing perfectly fine, you'll call them and you'll ask the police services for a premise warning. When you call them, you need to call the police station and not the 911 number that we're all familiar with. A premise warning is a term used by the police. It allows us to capture an individual's profile, and the police can use that profile when they come to see the individual when they're upset. They might see them at the person's home, their day program, their school. Wherever they see them, the police will have the information that they need to know how to support the individual appropriately. We've developed a template of the premise warning that can be used just to get your thoughts organized. This isn't the official version that the police will use, but can help you document things early on. You can download this, print it off, and fill it out, putting in the main pieces of information that we've talked about today. Then, when you call the police station, you can speak with the officer and ask for the premise warning. When you ask for the premise warning and you start to give your information, you'll be able to work off the items that you've documented on this piece of paper rather than making it up in your head as you go along. So when we talk about crisis plans, we're primarily speaking about paper plans that have existed, that have been developed with families, with caregivers, and with service providers to know how to de-escalate a person who is presenting challenging behaviors or mental health needs. When we talk about de-escalation techniques, we can talk about a few different things, and I'll walk you through an example in a few moments. We need to consider tips for police on how to interact with the individual. Some good examples are giving lots of time for the individual to answer the questions. None of us like having millions of questions thrown at us without having a chance to answer a single one. So when we're asking a client or an individual we support a question and we want them to answer, we need to give them sufficient time to answer that question, and also time even before that to think about what they want to answer. So we want to think about what the clients like and don't like. We want to tell the police a few details about that, because that will help the police in forging a connection with the individual and helping them to walk through the situation that they have at hand. Another thing that we need to think about for the police is, what are things that actually can distract the individual? Is it things such as favorite foods? Is it discussions about favorite activities, games, books, cartoons, things like that? We're going to show you a slide that will help you to kind of understand what a premise warning is and what it can look like. I'm going to call this person Todd Murphy, and he's about 35 years old, almost turning 36. He lives in a group home with other folks with an intellectual disability, and he has a mild intellectual disability, autism, and an anxiety disorder. He also has epilepsy, and that means he has a seizure approximately once a month. It's well controlled with medication. Todd's language and understanding of things is at the level of approximately a 3.5-year-old when you think about his developmental capacities. He has a crisis plan that exists regarding his aggressive behavior, his self-injury, and his paranoid thoughts. A copy of that plan is on site at the home. Todd can become particularly aggressive when he thinks other people are talking about him. If he becomes suspicious of that, he might become aggressive. He might also become self-injurious, which means for Todd, he might start banging his head on walls, doors, furniture, anything that's around him. So we need to think of the de-escalation techniques. What we might tell the police is that if you ask Todd a question, like we said earlier, give him lots of time to process and answer. Todd loves Jungle Mania. It's a cartoon that's on TV and he just loves it. Ask him about his favorite characters, the noises the animal makes, the theme song for the show. If the police ask them about these things, he will really be distracted from what's bothering him at the point in time that they come, and that will help him to calm down and not be quite so upset. Todd also has a small stuffed raccoon called Rocky that he likes to carry around with him. It can be used as a calming item. He likes to pet it, he likes to pretend to make it talk, and it's really important that it goes with him if he must go to the hospital. So if Todd does need to go to the hospital, how can the ER be prepared? One of the most important things to do is to have someone call the hospital and speak with an ER staff when the individual is on the way to the hospital. This doesn't need to be the staff or the family member that is actually going along with Todd, but it's important for somebody to go to give the ER, the emergency room, the heads up that they're coming. That person who calls can provide an overview of the individual, just like the profile of the premise warning that we talked about giving to the police. That person can explain what was happening that led to the ER visit. And they can identify what will support the individual at the ER. It might mean that somebody like Todd would really benefit from having a quieter space away from all the other people who are waiting. He might also need a drink of water, a snack, use of the washroom. Those are all things that if it's available to him, it will make his visit at the ER a lot more successful. So then the question becomes, how can you help in the ER? You as the staff that is taking him there, you as the family member that is accompanying him. Number one, you can act as an advocate for the individual. Unless specifically instructed by the medical staff, you should always be with the client. Number two, you should bring the individual's crisis plan to the hospital. Share it with the hospital staff who speak to you. Tell them what the crisis plan indicates. Don't assume that they've read it cover to cover like you have. One little thing that I know we can all use when we have to wait in lines or wait at the hospital is to have some calming and soothing items there. Todd might bring Rocky, you might bring a Sudoku book, you might have people who bring snacks and drinks. All of those things are important to pass the time, to distract, and to help people feel well while they're waiting to be seen. When you speak to the folks at the ER, you need to share any previous experiences that the individual has with using the emergency services or other hospital resources. This is important so that the hospital staff know the entire picture of the client and what they are dealing with. Lastly, and most importantly, your role is as an advocate. That means you need to ask questions. You need to focus upon the most pertinent information. That was why the person came to the ER. And you need to ask questions about what the next steps are for their care and ensuring that they're well taken care of during their ER stay.